So, hello everybody. I would like to welcome you to the LLR LMC webinar today around understanding practice contractual responsibilities around immunisations, particularly in relation to travel. This is an area that the LMC gets a lot of kind of questions on. So we hope this will give you kind of some insight and opportunities to ask questions as we go through. As we know, this is being recorded today, so we'll be circulating it afterwards, as well as obviously having the opportunities to ask questions. If you put them in the chat or raise your hand, there'll be opportunities to ask those kind of questions. Also, I'd just like to introduce my colleague, Dr. Danji. Dr. Danji and Mira Taylor from the LLR LMC, and they'll introduce themselves as they kind of speak. So I'd like to just kind of kindly welcome Fareen.
No, stopped again. Keep your phones out.
If you guys aren't on mute, if you don't mind muting, please. I think somebody's not on mute. Thank you. So hi, everyone. I'm Fareen. I'm a GP by profession, and I'm the Deputy CEO of the LLR LMC. This is an area that we get contacted on lots and lots of times, particularly around sort of travel clinics and sort of practice responsibilities, et cetera, et cetera. And this is quite a funny area because it's a little bit confused, and what we've tried to do within the slides is to go through it piece by piece and sort of work you through. There's a lot of guidance on the LLR LMC page anyway, so hopefully at the end of this you should be able to look at that. So the things that we were going to look at covering today was around travel and understanding basically what the obligations are. What do you need to do as a practice? What sits within core contract, what doesn't, and this is the bit that gets quite tricky. What is NHS and what is private? So it's just trying to understand that. And once we've sorted that out, then you can sort of understand the charging rules and whether or not you can charge patients and what you can charge for. And then the other big thing that we sort of get asked a lot about is consent, and where HCAs sit within sort of vaccination rules. And so I thought we'd sort of try and cover that a little bit. So that's kind of what we're going to try and do today. Travel, just before we move on, it was just to say travel is one of the funny things. So as GP providers, as we're aware, we're not allowed to provide private services for our own patients. However, with the travel vaccinations, this is the one part, actually, there are some bits that we are allowed to charge for, and hence this can get quite confusing. I know it's kind of like a bit of a nightmare for most of us to sort of try and get our heads around, because it's not normally something that we do in terms of sort of private work for our own patients. But with travel clinics, like I say, particular vaccinations, we're actually allowed to charge. So we'll work through that as we go through. Next slide, please, Charlotte. So yeah, so travel clinics per se are not actually a contractual requirement. So, you don't have to have set travel clinics in terms of sort of providing the whole shebang about traveling, as you would get from sort of a Boots travel clinic or a Asda travel clinic or whatever. So that's not a contractual responsibility. However, there are vaccinations that may be needed when people travel abroad that are actually covered in your core contract. And actually, there was change in contract back in 2001, if I'm not mistaken, whereby most of the vaccines that were otherwise a separate sort of payment got put into your core contract. And those NHS travel vaccines are part of your core contract. So they don't actually, they don't invite any extra pay. You don't get any additional kind of IOS payment. It's not like the flu vaccine or the COVID vaccine, which is completely different, which is a separate ES, and neither is it like your sort of childhood vaccinations, etc., where you get an extra IOS payment for doing that. The funding is actually in your global sum, and that was put back in 2001. So that's been an arrangement that happened, 5 years back. So I think for us as practices, we need to remember that there are some vaccines that are, and it becomes funny because they're called travel vaccines, but they're not necessarily travel vaccines. They are NHS vaccines that people may need if they're traveling abroad. And those are covered within your core contract, and we'll go through those. You must understand that you've got to be very clear that the vaccines that are NHS vaccines, you can't charge. If you're doing travel clinics in your practices, then the ones that are not covered in core, then you can charge for those. So you just need to make sure that we're doing that correctly as practices, and we'll go through that a little bit more in detail. Next slide, please. So, like I said, you don't need to provide a whole travel clinic. And I think we get confused around this. So a lot of practices don't necessarily provide a travel clinic, but they will send risk assessment forms. And this comes down to the fact that if the nurses are actually doing vaccinations, they need to be sure that the vaccinations that they're giving are actually the right vaccine. So for anyone that's giving a vaccine, I'm not just going to give a vaccine, just give it. I need to understand why I'm giving it. What's the reason behind that? And that's a little bit different from doing a whole travel assessment, sort of saying, oh, okay, all right, you're going to Peru, you need malaria and you need this and you need rabies. It's not that. It's that bit around actually, okay, so you've seen somebody, you've seen Boots or wherever you've gone. I don't know why I'm picking Boots, but any travel clinic that you've seen privately has then said, okay, you need X, Y, Z and the other. You also need these vaccines, but these vaccines are available on the NHS, so you don't need to pay for them. You can get them from the practice. Then that patient will then come to the practice in order to get their NHS vaccines, as it were. Private vaccines would happen privately. And so this bit about that whole pre-travel risk assessment, that's not needed from a contractual purpose. So whatever we're doing, we have to still give our core vaccines. And for that, then obviously staff need to be trained appropriately. Everything needs to be sort of sorted out, which obviously is happening in practices, I'm sure, for all your immunization clinics. So making sure that they've done the relevant training. If you're going to provide a travel clinic, i.e. the whole shebang, then parts of it, remember, are not core contract. So you need to make sure that the staff that are doing it are indemnified correctly. So whoever your medical defense organizations are, MPS, MDU, etc., you need to make sure that you've run it past them and make sure that the staff are indemnified for that. So within that travel clinic, then if you're providing the whole thing, then you're providing the whole shebang. So you're going through malaria, you're going through insurance, you're talking about the travel risks, and don't go bungee jumping, Farine, in case you bang your head and never come back, whatever, that kind of stuff. So that will be the whole shebang travel clinic. But then the person providing that advice needs to be indemnified. If you're not doing it, then like I say, what you would do is signpost your patients and say, look, we're not offering a travel clinic. Please go, wherever, whatever your local arrangements are. And you may have some providers next to the practice that you guys are okay with working or whatever, so you can pass them on from there. What I would suggest, though, because the NHS vaccines are a core contract responsibility, you could probably say, well, if you're due to travel, guys, make sure that you've then booked in and got your travel assessments, etc., done, and then to book back and get your NHS vaccines at the practice, then they need to give you a time frame as well. So you could probably say, 8 or 10 weeks before you fly out, which gives the practice time to sort of organize that, and obviously allows, because you can't have the vaccine the day before you're flying out because it's not going to work. So, you've got to have some time frame within that. So I think 8 to 10 weeks is probably a good cutoff. And that then puts the responsibility on the patient to make sure that they've done all the paperwork, they've gone and seen the relevant person, and then they've come back and to get their NHS vaccines. And the same thing, if you're providing the entire travel service, you obviously don't want people showing up the day before they want to fly away. They've got to have some time frame within that. So make clear policies about how much time you're going to give people, and that way you're not sort of getting caught out shorthand. Next slide, please. So yeah, these are the travel vaccines that must be provided on the NHS. I'm not going to go through that. The vaccines, guys, and the payments included in the practice global sum, like I say. The only other thing I was going to say, what we do have on the LMC website, if you don't provide a travel clinic in your practice, there's a bit of a disclaimer on that. And what the disclaimer is a patient disclaimer saying that they've got the advice from somewhere else, i.e. they've gone and seen somebody privately, they're just coming back to the practice to get their NHS vaccines, which are these 6. Next slide, please. Yeah, so these ones are the private travel vaccines, as we've talked about. So these ones are definitely not in your core contract. And if you're running a private clinic, then you would be providing these, and these are your yellow fever, your rabies, etc. And again, like I say, you must make sure that staff are indemnified to do that. You can't use an FP10 to prescribe these because these are private. So what you need to then do is buy the vaccine in, and then charge the patient for the vaccine, and also you can charge them to administer it. So I don't know, if yellow fever costs you, 200 quid, you're paying for the 200 quid, you're going to pass the cost to the patient, and then you charge them whatever, 15 quid to administer the vaccine, whatever your arrangements are. So for those, you would charge the patient for the vaccine, and you would also be able to charge to administer them. Next slide, please. Yeah, so this is a little bit complicated, and even I struggle with this one. Me and Charlotte bang our heads with this one. And these are vaccines that can either be private or NHS, and this is the Hep B single antigen vaccine and the MenACWY. And the problems in our entitlements, so the SFE documents sort of put this in there, which has kind of caused a little bit of a problem. And in there, there's a bit around the fact that actually, if it's due to do with travel, then you could actually charge for it or choose not to do it. So, but I think as a practice, then you've got to be very clear. Either you're providing a full private travel service and you've made that very clear that that's going to be charged for, or actually you're not, and then this is going to come out of the NHS bit, but you can't do a mixture, if that makes sense. So you can't mix NHS and then private and mix that all together. So either you're charging for the Hep B Men C or you're not, and it's coming out of the NHS pot, if that makes sense. Next slide, please. So yeah, in terms of sort of charging rules, like we've said, you've got your private travel vaccines, you've got your malaria, your travel kits, etc. And you may need to do certificates if you're doing them. So I know when I traveled in the past and I've needed rabies, whatever, you get the certificate, you can charge extra for that as well. So that's fine. Next slide, please. Yeah, so I think this was another thing that did come out recently, and this was around the governance and the risk management. So I think, again, it's just making sure that you've got your policies written properly, you've got them sort of documented, you're providing sort of clear information about fees if you're providing a private clinic, what the charges are, if it's not private, what the process in place is, make sure obviously staff are trained, etc. And then the policy needs to be consistent, isn't it? So you can't one time charge for something and then the next time not charge, and this comes back to the Hep B Men C. Stick with the policy, because otherwise it will fail the Discrimination Act. So you've got to be consistent with whatever you're choosing to do. Next slide, please. Yeah, so I think, yeah, these are a few bits that we've come together and just sort of put together. Anybody else has anything else to add, please let us know. But yeah, we were just sort of saying, make sure you sorted out your Hep B Men C thing, whether it's NHS or private, make sure you're putting clearly on the website around sort of private services, and then if you're not, what you have actually put on your websites or whatever in terms of the timeframes, and making sure you sort of adhere to those, and then the audits, etc. So yeah, I think that's fairly self-explanatory. Next slide, please. Yeah, so again, I think these are the key messages. Travel clinics, in terms of the clinics themselves, are optional. The NHS vaccines are not optional. Those are part of your contract. It is in your core contract. You've got to do them. Private vaccines obviously charged. And yeah, I think that's fairly self-explanatory. And then next slide, please.
Yeah, we just come to the end of that particular part.
Perfect.
I did say to Farine before we started this, I said, if anybody knows Farine, they know she speaks about 100 miles an hour. So I said to her, speak slowly. She obviously didn't listen to me, but anyway, does anybody have any questions at this kind of point? Because obviously we're happy to kind of go through kind of some scenarios, or if anything kind of wasn't clear. We know there's such a different kind of approach within LLR. Some practices are not delivering any of these kind of vaccines, particularly in relation to the NHS ones. And we have concerns that obviously they're being breached of their own kind of contract. So we just want to kind of share the same message around, obviously, so everybody kind of hears it. Claire, I think you have a question.
Hi, it's not me that has a question, it's my nurse lead.
Okay.
Hi.
That's fine.
Clarify something. So, and it's what you were saying at the start of this, is that if a patient goes, let's just say to the Boots for a travel consultation, and they're told, yes, you need this, and this, and they're an NHS vaccine. Yeah. So they come to us to have that vaccine. The nurse giving that has to have done the actual travel vaccine course, as opposed to just being able to give that vaccine. And the reason I say this is because this has been queried with the RCN and the NMC. And what they say is, that's okay, but you're still giving that vaccine. You still have to have an understanding of what you're administering. And I think that actually does cause a little bit of confusion. It certainly caused me confusion, that yes, it's all right them going to have it, and they come in and they say it's been assessed, do you need A, B, C and D? But people are humans, they do make mistakes, and potentially if we give something that is not needed, we have to take some responsibility of that as well. And that is where it's quite conflicting against what you're saying, which I completely understand, but actually against, my registration and what I have to do in terms of the NMC.
And yeah, that's a really interesting point. And there has been that question that's come back round and round. And this is why I say the person giving the vaccination needs to be happy that they're feeling competent enough to do that vaccination. So the whole idea about putting the disclaimer on that LMC website, and we'd run that through, was the patient's gone there. So in a way, you're sort of saying, I'm working in good faith here, that this person has been assessed by X, Y, Z, and the other. It's pretty much like, when you get requests from consultant Y saying, can you give this vaccine, or, so-and-so has had whatever, you need to then be clear in your head that you're happy with that indicator, isn't it? And if you're not, then you're not, isn't it? But in terms of the NHS travel vaccines, then there's got to be that. So this is the problem, because they get called travel vaccines, is where the problem comes in. But if you think about them, they're actually NHS vaccines that are meant to happen during the life course of the person anyway, aren't they? Like take DPT or whatever. The reason they're having that extra DPT when they're going off on holidays, because they're at a slightly increased risk, or whatever it is. So that's the reason you're giving it. So I guess, like you say, it's that bit about being clear in your head that you are. I mean, you don't have to know the entire travel bit about, they need malaria and they need this and they need that, etc. But the reason why you're giving it as to what is happening, if that makes sense. I hope I'm making sense.
It absolutely makes sense. So you make a very good point. If a consultant asked me to do something, I would not give it if I wasn't sure about it. So a lot of things, like with consultants, might be they need their vaccines again because they've had a transplant or something. So I as a nurse, I'm understanding of that, because I know that's a process. What I'm not confident as a nurse is, you're quite right, they are having these NHS vaccines because they are travelling. Of course, we want to make sure people are safe going and coming back into the country. Absolutely. But some of these vaccines, that there is some travel issues around them, and that's where the RCN is saying, if you're giving these vaccines in primary care, you have to have a good understanding of why they're being given, not just because that person is travelling. And that's where, so for example, and I'm not trying to be difficult about it, it's about registration and it's about safety for everybody, because the best will in the world, a pharmacist or whoever's done that initial consultation may have made a mistake, and then we've just given it.
Absolutely. And I completely understand what you're saying. But what I'm trying to say, actually, it's not like the vaccine's just being given. It's about the safety bit, isn't it? And it's the bit about them being covered in the NHS. So in a way, I know that I think the word travel vaccine is the bit that causes the bigger problem. Do you know what I mean? So like you say, if somebody's had a bone marrow transplant or whatever, and they need their vaccines again, you'd go back into the green book, you'd look at it and you'd be like, yep, this is completely fine. This needs to be done. And you'll give it, isn't it? Because that's kind of, what it is. And that's covered within the sort of core contract of doing that or whatever. If a consultant then says, I think Farine, because of whatever, needs an RSV vaccine that then doesn't sit within your PGD or whatever, you'd be like, I ain't doing this. It doesn't make sense, just because the consultant decided Farine needs an extra vaccine because it fits his kind of thinking of whatever it is, then you're not going to give it, isn't it? But these vaccines are not, they're not out of that schedule, if that makes sense. So
they're not.
Yeah,
and you're right, there's PGDs and everything.
Absolutely.
However, if you look at the PGDs, it does say suitably trained person that's had the thingy, and that's the point. So I'm going to be very honest with you. We would be saying we would do our own assessment, because then we're taking full responsibility for it.
And I would agree. And I think as somebody doing something, and this is the bit that comes in, isn't it? I'm not just going to give somebody a vaccine because Mr. White told me to do that. I need to be happy that I understand why I'm doing that. So that level of training will come back down to the competencies, and that would hopefully be being picked up as the IMS nurses working within the practice. So, it's just like your childhood vaccines or anything else. You're not just going to give them. You're understanding why you're giving them. You're going on the courses that are keeping you abreast, etc., etc. So you're keeping on top of your competencies. But what I think the difference is that we're not expecting that level of expertise where you're drilling down to a complete travel clinic, where you're saying, well, you need rabies and you need this and you need malaria prophylaxis and, you're climbing Mount Kilimanjaro. Have you thought about, azithromycin, whatever? So it's not that level of kind of, I guess, detail that you're going into in that assessment.
No, and I think that's a good point. I think what it does reinforce is you do need to go on the travel course just to have a good understanding of those vaccines, generally speaking, because You're right, they're NHS vaccines, but they are being given for the purpose of travel.
Of travel. Yeah, absolutely. And I think that's the key thing, isn't it, really? And I wish we could change a little bit of the terminology on that. It may help a little bit of the confusion around it. But yeah, anyway.
Thank you.
Thank you, Claire. We did have another hand up, but it's now gone down and I can't remember who it was. So if you do want to ask a question, please feel free or put it in the chat.
That was me, Charlotte. I'm Carol from Uppingham Surgery, and I was just jumping in really what Claire was saying. So Farine, I know what you mean. It's about them being NHS vaccines, and that's right, but they are actually not part of what you would normally give a patient during the course of their life. For example, typhoid or hepatitis A. You know, that's not part of our schedule. Yeah. So, but I think you've answered that. We do need to make sure our nurses have gone on a travel update, which is a shame because they've got to go on the update, which is time consuming and it's costly and it's time out of normal work. So yeah,
part of me sometimes thinks, and I will say this like amongst friends, it may just be worth everyone set up private travel clinics and actually make some money out of it in the whole process, because this whole bit around these bits being NHS vaccines and in the core contract causes a lot of angst for everyone, to be fair. So I completely understand that. I appreciate part of me sometimes when I'm chatting with Charlotte is like, why not just provide a whole travel clinic and go with the shebang, of providing the whole thing. But yeah, anyway, we can only do what we can with the workforce we have. So yeah, absolutely.
Thank you. If there's no more kind of questions, I'll move on to the next bit, which is probably equally contentious, and it's around consent. So this is something that comes to the LMC quite a bit, and we've kind of put some information out there. So Farine's just going to kind of cover it within the next kind of part of this.
Yeah, so this has caused quite a lot of sort of contention more recently, and I think it's just because AXA sort of strengthened their position. This is not a new thing, guys. This has been there for as long as HCAs have existed, really, in all fairness. And it's quite clear HCAs aren't actually registered healthcare professionals. They cannot take consent. It's very simple. That's not changed. I'm actually quite astonished sometimes with the question I get about, oh, but our HCA used to consent, and like, no, that's never been the case. It's never been allowed. It does not sit within their remit, in all fairness, and this comes back to sort of the competencies and things like that. So I think last year, was it last year or the year before last? Obviously, AXA sent out a bit that came out, and that sort of caused a lot of trouble within general practice. We've obviously got around some of these bits, and within sort of COVID, when we had COVID, and we used to have the national protocol. But then, if you remember, the national protocol broke things down quite clearly, and in the consent process, non-registered healthcare professionals were not included in that. So the consent needed to happen by a registered healthcare professional. And then once that was done, the HCA could work under the national protocol and deliver the vaccine, if that makes sense. Or not deliver, but administer, yeah, same thing, administer the vaccine. So I think this is the bit that we were sort of going to try and hone in on. And it was just to say, look, they can administer the vaccine as long as that they've had their training, pretty much the sort of the competency assessments and the training that they normally get. But the consent is coming out from a registered healthcare professional. They're working with that registered healthcare professional. So my HCA is working with me as the whatever the vaccination lead in the practice, and I've done the consent. I've sorted out the PSD, and I'm happy, and I feel my HCA is competent enough to administer the vaccine. But he or she is not doing the consent. The consent's coming from me. So they're either working under a PSD, like I've said, it was the national protocol or the vaccine protocol now as it's called. So there is a specific bit that they're working under. They cannot work under a PGD, and we'll come to that. So the PGD, which is the different legality under which the other guys work under, the HCAs cannot work under that. So they need a patient-specific directive, and that's the word. It's specific. It's for that specific patient. A PGD is obviously a group directive, so it picks up a group of whatever the group is. So, everybody between the ages of 50 to 70 need this vaccine, and that will be covered under a PGD, and, a nurse can work under that. But for an HCA, they cannot work under that PGD. They would need a specific directive, and that would say, this is the vaccination for Farine, and we have worked it out. Farine needs the vaccination X. I've consented her. She's aware, happy, whatever. Now, HCA, please give Farine her vaccine under this PSD. So it's a specific directive. Next slide, please. Yeah, so I think I've covered that in sort of talking about that they cannot actually work under a PGD. This is meant to be for people that are registered healthcare professionals. So yeah, next slide, please. Yeah, so what was this one? Yeah, so this was just about the person that holds the responsibility. So whether it's the registered clinician or whether it's the GP, they need to be clear that the HCA has had the relevant training, they've done the bits around the consent, and they've made sure that, you know, there's a relevant mechanism in place for this administration, and that normally tends to be a PSD, in all fairness. So that's fine. Next slide, please. Yeah, so we would this is just a little bit around kind of the responsibilities that we have, and that sort of complies through, doesn't it? Next slide. Yeah, so I think this might be helpful, and it was just for a travel clinic, because obviously this is around travel. We've just put in there sort of the bits that can happen, and you know, the different people that can do what, and I think it boils down to the HCAs are working under the PSD, and then they can administer the vaccine, but everything else is then happening by the registered healthcare professional, if that makes sense. Next slide, please. Yeah, so I think we've covered that, haven't we? So HCAs can only work under the PSD. That cannot sort of independently be running a travel clinic without all the other appropriate things being put in place, because that main bit sits under the registration of the registered healthcare professional. Next slide, please. Yeah, yeah, so these are just some references that we've sort of put on there. I think there's a fair amount of sort of information on our website, guys, including the disclaimer that we talked about, and then we've put some other bits and pieces in there. I think another really useful document actually that we haven't shared that I might pop into the chat is about the core responsibilities under vaccination for practices. So this is what happened in 2022, and we'll get that shared out or put that on the slides that we shared out, because I think that's a question that comes back a lot. Let me just see if I can find that one actually. Yeah, there we are. I'll just put that in the chat for everyone, so you've got that as well. So this is the core responsibilities of a practice for vaccination under your contract. That's all, folks. Shall we take the slides down and just allow people to ask questions then? We got
yeah,
Carol. Yeah, Carol.
Hi, just a question about nursing associates and consent.
I was waiting for this one. So this is a really interesting one, isn't it? Because the NMC website says yes, but my understanding is they can't because they're not considered part in the PGD mechanism. That's what my understanding is. And funny enough, prior to this, I was saying to Charlotte, there's apparently a petition waiting to go to government to allow NTAs to actually work under a PGD. So my understanding is not. NMC's understanding is yes. I don't know the answer, in all honesty.
Okay, thank you.
I can share the link for you for the petition if you want.
No, it's okay, thanks. Thank you anyway.
Because the NMC is saying yes, isn't it, Carol? So hey ho. Rachel?
Just to confirm, nurse associates need to still work under a PSD currently, and that they still really need that again. Yeah. So again, prescribers need to be doing the PSDs for nurse associates as well.
Yeah, I get that, Rachel. It's just about the consent. So yeah. If there were, you know, if I did a PSD, say for a flu vaccination, can the nursing associate gain consent for that flu vaccination? No, they can't.
No.
Okay.
On a PSD, you can't. Yeah.
That's fine. Thank you.
I think anything that sits under a PSD means the consent's coming from elsewhere, isn't it? From some source. As soon as you're actually having to use a PSD as the mechanism of actually administering a vaccine, that means all the other bits that happen outside that sit under the registered healthcare professional, including consent.
That makes sense. Yeah, that makes sense.
Yeah. I think that's the easiest way of looking at it, isn't it? A PSD is only a leverage to allow somebody to actually give the vaccine, so that they're actually just the guy doing the vaccine, but not anything else to do with the process. And that may be the easier way of trying to make that work. I mean, it's a bit still conflicting advice around nurse training associates. My understanding is they only work under a PSD, but I was looking at the NMC website last night and it's all under review actually at the minute, but it does say on there that they can. So I don't know. I'll be educated when that comes through and the review happens.
Well, let's wait and see.
Guys signed the petition is what I'd say. I'm surprised there was only 900 people that signed the petition. I did sign it myself last night. I thought you need 10,000. Come on, guys. You want your nurse training associates to be able to do this, sign the petition.
that naturally brings us the end to our presentation, but we're more than happy to kind of answer any kind of questions, points of clarity. Rachel, did you have any kind of questions in relation from the training hub perspective in relation to any points of clarity, or all clear, or?
All very clear.
I'm putting you on the spot just because I can see you.
You're fine. All very clear. Regarding travel, nurses need annual travel training again. Obviously, with the decommissioning of the T&D, that's something the Training Hub are looking into to ensure you get annual travel. It's, as you know, vast across LLR. Some clinics are travel clinics in surgeries, and others aren't, and others just provide core and things. And I think it's just looking at your policy, making sure, like you say, you've got all of the legalities and things there. But no, there's nothing to add. I think you've been through it all, which is fab. And just to clarify, with the nurse associates still needing to work under a PSD.
Okay. Before I naturally bring it to a close, does anybody kind of have any questions? Otherwise, I will kind of finish the recording, and as a result, I will send the presentation, and the links have kind of been shared within the chat. Okay.